Good morning, good morning, good morning. It's good to be back before you again to provide our monthly COVID update for Liberty County, and this time be Liberty County specific, as we don't have our partners with us today, but we want to maintain our presentation, our presenting to you, so that you as the general public would be kept abreast of what's going on in and around you. Thank those of you who have been consistent, who have been following us from day one, and those of you who just kind of pop in occasionally, but certainly we know we'll be here every first Wednesday at 11:30 unless something changes, and we'll be certainly sure to let you know should that time frame change. We want to thank our media team, too, for their support. They've been very diligent in helping us to bring this to you, the general public. I am getting feedback from you that you are following us and that you do watch us and you do share the information, so thank you for doing that. Well, we're still in the midst of a COVID season. I have not heard that the flu season has been bad here in Liberty County, so thank you for those of you who have been vaccinated in flu and who are practicing the social distancing and wearing your mask and washing your hands. That certainly helps with the flu spread as well. But we do want you to remain vigilant in that we're still in this season of having to be careful and wanting our stats to improve as the time goes by. Now we're in the month of February, so the year is moving very quickly. We have been told that perhaps in the next 2 weeks, maybe 3, and Mr. Brown can speak to that, we should see maybe a decline in the number of exposures. We are grateful, though, very, very grateful that there are less hospitalizations, at least serious hospitalizations, i.e. being on ventilators for the general public. We appreciate that because we know that was a lot of wear and tear on medical staff, as well as our first responders of every kind. Whether you're in fire or police or EMS, when you make those calls, you're always cautious of your surroundings because you want to be careful to protect those who you're caring for, yourself, and of course their family members also. So please remember that this pandemic is more than just individuals, collective, and that we have to be our brother's keeper, as we say. Mr. Brown will speak to the county functions. I will say this, we do share notes with our municipalities, i.e. the cities, Walthamville, Hinesville, Mildred, Riceboro, so on and so forth. We share notes with them, so we're all kind of on the same sheet of music, as they say, when it comes to being cautious. So you should see pretty much consistency across the county and in a lot of the workplaces also. A lot of the stores I'm noticing have a sign that says voluntary, but we ask you to make it more than just voluntary. We ask you to volunteer, actually, to mask up when you go inside a facility. A little different on the outside, but when you're inside a facility, please be careful about social distancing and masking up. Just those things that have become the norm to us now that we're asking you to do. And I think we've been doing this for a long time, So this time I'm going to yield and ask Mr. Joe Brown. He will come to you and give you the update from Liberty County. Please welcome him.
Thank you, Mr. Chairman. It's a privilege to be able to address you again, and not only as it relates to COVID, but also just for some updates about what's going on in the county to try to help out things. I always bore you with some stats, so I won't change my protocol there any. We'll talk about a few of those. In Liberty County, to date, we've got about 11,578 cases of all types and strains. This goes back to the start of the pandemic. There are 102 deaths in the county accumulated to date. We had 26 new cases in Liberty County yesterday of COVID, and unfortunately we had one death yesterday from COVID. The community transmission index is down a little bit from last time. It's down from, on the 21st, it's down from about 3,500 to about 2,800. That's still extremely high. But as the chairman mentioned, the encouraging thing is that appears to be going in the right direction. Our number of positive tests continues to run high, and I think it's with the latest variant that we're seeing, but that number is hovering around 45%. We have seen numbers generally around 15, 18% back 6-8 months ago. So it is still up there, still elevated. Cases at the hospital are steady. As the chairman mentioned, there aren't as many serious cases, but I will share with you after a conference call a few minutes ago that we have is that our hospital is full today. In fact, we have several that are waiting on beds. Now, that's not all COVID-related cases. That's just hospital statistics in general. In our county, our vaccination rate of one dose is 34%. Fully dosed is about 30%. And fully with that additional dose is only about 35%. So again, just to remind everybody, that additional dose, those boosters are important. That is what has led to less serious illness for those patients who have unfortunately contracted the disease, especially the latest variant. That dose has really helped out to keep them out of the hospital as an inpatient. We do in the emergency service sector, in the hospital, in our emergency public sector here, we are experiencing staff shortages like everybody else. The new variant or a variant has run through our department, so at every public safety level, we're experiencing that. For that reason, I would ask you, please, we've had limited resources that have been available from certain days of the week here recently. Please only call for an emergency unit, whether it's EMS or fire, or something if there's an emergency, please, because we are short on personnel at this time, not uncommon to most businesses in most sectors right now. Let me shift to the testing just a minute. First, as you know, the federal government has authorized some free tests to be distributed to homeowners. I know testing has been a concern, especially as it's become a requirement to get back into the workplace. Trying to get these tests and get them promptly is very important. That site, the federal site, is COVID test, plural, TESTS, .com. If you'll go on that site, it's actually through the Postal Service, and you'll be able to order your free rapid test to be able to get to you. Not to be held in stone. I'm told from just things that I hear that the average delivery time somewhere is running between 7 and 10 days right now. Obviously, that's going to be dependent upon the number of tests that are available. The testing at James A. Brown Park, which is not a rapid test, continues every day of the week from 8:30 to 3 o'clock. You're encouraged to go on the website there for DPH and take a look at that information along with other DPH information. You can go to Coastal Health District. If you'll Google that, Google will tell you anything, obviously. Pull up the Coastal Health District. You can look at these stats. You can also look at their testing requirements. They do not do rapid tests, so you can go on there and make an appointment. There are also some testing sites, if you Google, that will come up. These change periodically based on type of test and test availability. Some of those that have been available from time to time are at Liberty Regional Medical Center's walk-in clinic, St. Joseph's Immediate Care, CVS, and Diversity. And you'll have to check those sites independently for their test availability and or call them to do that. Let me talk about statewide beds that are available because this is a little concern, especially as hospitals fill up for one reason or another. Statewide beds right now, 85% of the beds, inpatient beds in the state, are occupied. That's a high number. ICU beds for critical care, that number is even higher. 87% right now statewide are in use, which is bad. I think a little bit of good news, if there is some, and it relates back to the seriousness of the illness a little bit, ventilators that are in use, though, are only at 33% capacity right now statewide, which is good. The state's divided into emergency zones for emergency care. We're actually in Region J, which I will call, for simplicity, the coastal area. Inpatient beds in our area, in about a 6 or 7 county area, 80% are taken at this time. The ICU beds, not as good as the state average. That's at 92% right now of ICU beds. And again, not just COVID related, but total ICU availability for any reason. Our ventilators, about 19% in Region J at this time, are taken. I'm going to go back a second. There's one thing I want to mention that I was asked to mention in the Facebook broadcast this morning, and you may have already heard this, but not necessarily only brought on by COVID, but blood supply and blood shortages. There is a dire need for blood. Across the country, and especially in Georgia right now. The Red Cross has put out several pleas for that. The hospital mentioned that in their statement this morning, and I wanted to carry that forward to you. If you're a potential blood donor, please consider going online, contacting the Red Cross, and going and donate blood. They are at critical levels right now, and we're not even in, quote, a disaster time, although I would probably argue that COVID is somewhat of a disaster, but please consider donating blood if you will. Our operations at the county level pretty normal. I will share with you that because of the increased case numbers, the county did have to issue a declaration of a local state of emergency in response. This was actually done a couple of weeks ago and ratified by the commission. I'll explain real quickly just some changes that we went backwards to. I'll say one step. One of those, if you're in a building that is county owned, you will need to wear face coverings and practice social distancing. And those are for CDC guidelines. Face coverings must cover the nose and mouth area and must be multi-layered. So they must secure to the head. In those same buildings, temperature screenings are required. If you're experiencing 100.4 degree or higher of a temperature, you will not be admitted to the building, unfortunately. This is for your safety and others' safety as we try to continue to serve you. Internally, employees and vendors practicing the same guidelines in there. Employees are not gathering in large groups. We are pretty much virtual in meeting mode. We're only attending mandatory conferences, and we're limiting travel at this time. Meetings of the Board of Commissioners continue. They continue to be open only to those that have agenda items to address. They're on the formal agenda. And you can contact the County Commission office to discuss those agenda needs as always, or to check to see what the agenda material is. But again, very much limited, especially rezoning matters, to those people who only have matters related to that item on the agenda. In recreation facilities, the Commission did not stop any recreation activities. Programmed activities continue. However, if you're not in a programmed activity and you're renting a facility that is rentable through the Recreation Department or through the county, capacities have been limited to 50%. So that is being monitored by staff folks that are there for those events. In recreational programming, program participants as much as possible are encouraged to practice distancing. We do ask that they mask inside those facilities when they're at those events. Of course, outdoor facilities, there are no mask requirements. We do encourage some distancing there if possible. Attendance, especially at the indoor venues, we ask that only family members come. We are just encouraging that. I would tell you that we understand too when different members of the family want to try to come. Closest of family members varies among families, obviously. And so we're not going to ask anybody to leave an event. We're just encouraging you to do that. We are sanitizing before and after events. These include gymnasiums that are owned by the county, and also by facilities that the county uses, mainly Board of Education facilities that the Board of Education has so generously let us use for these basketball programs, indoor events. So we are very careful to sanitize before and after everything. And I did mention the face coverings that are required by spectators. So we continue. The chairman said, I think made a comment about it, and it seemed like we may be doing this forever. I certainly hope not, but I do understand from one of our calls this morning there is a new variant that's being monitored. Not enough known about it yet to really, I think, be able to give any advanced look as to what may be required with that. You'll continue to watch it. We'll continue to watch it. And we'll continue to practice as the administration leg of the county safe practices for the employees and also look to protect members of the public that want to come in so that we can deliver the services to you. So I appreciate it very, very much. Again, it's an honor to be here, to be able to give you an update. And at this time, I want to yield to the Honorable Mayor Larry Baker of the City of Waltoville.
Good morning, and thank you, sir. I'm sorry for being tardy, but on my way here this morning to the meeting, I ran into 2 funeral processions. Didn't say it was COVID or anything like that, but I went to thinking about it. So nothing to take away from Chairman Lovett or our county administrator, Mr. Brown. We're still in this thing together. Let us continue on doing what is positive, wash our hands, wear our masks, and watch our distances. I want to say to the city of Waltoville, we did have an episode at City Hall, and I want to say thank you very much for using the online pay because we had to close and our drive-through. Our meetings are every second and fourth Tuesday at the hour of 6, and we're doing it Facebook Live. It's not close to the public, but yet it is close to the public because I'm not as big as the commissioner room here. But if you're on the agenda, you're welcome to come. But please, let us continue on, and one of these days, Chairman, we'll get through this deadly disease that plague our land. So thank you very much, and at this time, I yield back to the Chairman, Donald Lovett.
Thank you, Mayor Baker, Mr. Brown. I'm optimistic that one day we'll be able to have the mass burning that we thought we would have a year ago, but we're still here. Listen, but I'm of the mindset, and I think we all are now, that we're going to be dealing with this for some time. So, I mean, the world must go on. The world must go on. We can't shut down everything. We can certainly modify and put those practices in that will help to keep us all safe and safer. But we must continue governing, and we must continue, even when it comes to the, Mr. Brown mentioned the athletic sports, I'm hearing more and more reports about the behavioral health side, i.e. mental health side. Our kids need to get out and stretch out and run and jump and just release some of that energy, And adults the same way need to get out and do something. So go to the parks are wide open. Go to the parks, take that walk, take that run, sit on the bench and people watch. Whatever it is you need to do to just ventilate, and have some time to just relax your mind. So let's do that. But we're going to do our part, and we promise you that, to maintain safety for everybody, all the whether it be city or county offices and facilities concerned. That's our obligation to do that for you to the best of our ability, and we will continue to do that. So I thank our partners for being diligent. I thank them for their perseverance. I thank them for their vision and their collaborative spirit so that we work together. Mayor Baker said we're all in this together. It's not just one entity. We're all in this together. So thank you, too, for your part. I will say this. Mr. Brown mentioned the blood shortage. So please, ma'am, please, sir, if you can, donate. We are hearing that in some of our, let me just say, venues, that the adults could do better. Mr. Brown gave the 30% vaccination rate, which is real low. It's very low. So we need to improve on that if we're going to ever kind of get a handle on this. Because I know you're the mindset that we are, that you want to be able to do things. And spring is soon to come, time for the Easter egg hunts and all those kind of things, Then, of course, follows the summer months. So let's do what we have to do so we can all entertain and be able to enjoy the activities we are used to enjoying on a daily basis. So thank you once again for hanging in there with us. Thank you once again for being diligent. And if you have any questions, send them to us, and we'll do our very best to answer those questions. Certainly, after we close the live stream, you can certainly call the county office to ask any questions you may ask, and we'll do our best to answer those. Thank you. Have a good week. Have a good month. See you same time next month right here.